right? So, have you ever wondered what happens when light goes off in theater? I was operating in theater one of the days and light went off. Of course, many times we just assume that the patient is not worried. If you are from Nigeria, it's not uncommon for light to actually go off. And everybody's going to know because it's going to be obvious from the outside that there was a power outage. So, what exactly happens when light goes off? Because imagine if light goes off and something happens to the patient, it's only natural for the patient to say, well, that must have happened because light went off. So I'm going to really tell you what typically happens. So in the operating room, especially now I'm talking about surgeries that are being done, major surgeries that are done under general anesthesia, meaning that the patient is asleep. When the patient is put to sleep, there's usually a tube, probably in the mouth. The tubes are connected to anesthetic machines, and the patient is connected to monitors that will check the patient's heart rate, the blood pressure, oxygen saturation, and many other things. So, generally speaking, these systems have battery power. So the people that made it, so they are wise now. So there's battery power. So it's not immediately light goes off that the anesthetic machine or the monitor will go off. They won't go off. They have made quite well, and usually those machines can last several hours without power supply if they are still in good conditions. That's the point. If they are still in good condition, sometimes they are in bad condition. So if the monitor is in bad condition, it means that maybe after a few minutes it's going to go off. Yeah. And then you can no longer monitor the patient. You don't know what the patient's oxygen saturation is. You don't know what the patient's pulse is. What do we do in that situation? We would have to, most times, the anesthetists have uh, the regular small pulse oximeters that are battery powered, the regular AA or AAA battery powered. So if you have a Nigerian anesthetist that is serious, he's going to have that probably in his bag, and if light goes off, he's going to bring that out and use. That's one. As regards the machine that is controlling the patient's breathing, usually those ones too are battery powered, so they usually don't go off, and they usually have very good batteries. But if they are in bad condition, they may stop delivering oxygen the way they are supposed to. So in that situation, what the anesthetist is going to do is that he's going to get what we call an ambu bag, something that can manually pump air to the patient. It may connect that to an oxygen cylinder if a free oxygen cylinder is available, just to make sure that the patient is alive. All these things, basically, we have them. We have them in Nigeria. If you go to other countries, of course, their light doesn't go off and their machines are good. So those kind of scenarios will probably not arise. Now, what's the last thing? What about the surgeon? The surgeon is operating with lights. Without lights, that surgeon cannot operate satisfactorily. So when light goes off, power supply goes off, light goes off. Many of these lighting systems do not have batteries in them. Most of them don't have batteries because the white man who has made them does not expect power outage. There are a few of the mobile ones that they can move from one place to the other. These ones sometimes have batteries. So if it's in good condition, that means that you've not been using it for too long. maybe, of course, if you've been using a battery powered system for years, of course, the battery will no longer be strong. But if the battery is still good, sometimes they can last. In fact, some may even last up to 4 hours. So, surgeon can continue operating with that battery powered light. But if there's no battery power, what happens? Surgery has ended. Now imagine that is at the time when the surgeon is doing something critical. Light goes off. It has happened to me before. I was operating, and at the point where I was just about to catch a major vessel, light just went off. So what's going to happen? There are different options. One, thank God for phones. So people quickly put on their phones, many people put on their lights and shine it for you to just do the minimum possible, and then you stop operating. Knowing well that operating in poor light is very risky. So you don't operate in poor light and then say, oh, it's because they took off light. Somebody once told me a story. And they were doing a thyroidectomy and they took light and they continued using a torch to do the thyroidectomy. And at the end of the procedure, the patient could not breathe. So they now started blaming the light. I said that if light went off when you are doing a thyroidectomy, it's not compulsory to continue that thyroidectomy. You stop it at that point. Right. So we've seen pictures of surgeons operating with lanterns, with torchlights. That's very wrong to do that kind of thing. Right? Even though sometimes they will argue with you that, oh, we're trying to save the life of the patient, we don't do it. For example, you want to do a cesarean section, you don't do it. Patient may die, the baby may not survive. But every surgeon must pack of safety. Is even operating in that circumstance, is safe for that surgeon? You must always think about that. But all the same, if you decide to operate in that circumstance as a surgeon, know that it will not be taken as an excuse for your complications. Okay, so you don't operate terrible conditions and now begin to give excuses that it was because you were working in that condition that the complication happened. Now, to patients or their relations who might be sitting outside, most of the time, especially if you go to a hospital in Nigeria where there's some degree of sanity. Yeah. Hello. That in some facilities they don't have power supply, they have poor power supply, and they do not have backup generators. I'm not talking about those type of facilities, but in most places where there's some degree of sanity, when light goes off like that in theater, usually the patient is at immediate risk. So don't be too afraid, okay? As the relation, don't be too afraid that, oh, light has gone off. Hope my patient is still alive. No, patients don't just die because power has gone off. What actually may cause a complication in that setting is the surgeon not making the right decisions when light actually goes off. All right, so I hope I've answered this question that might have lingered in the minds of some of you as regards power outage in theater. See you some other time.